Hello, my name is Joel Straz, Health Officer with the Bay County Health Department, and today is Tuesday, February 23rd, and this is your weekly update for COVID-19 and the status of the COVID vaccine here in Bay County, Michigan. The numbers of confirmed cases have dropped significantly since November and December, and that decrease is currently plateaued, however. The test positivity rate is currently near 3%, which is good, but still not to 1% where we need to be as a county. We need to reinforce the important factors to stopping the virus that we have been using since last year: distancing, wearing a mask, using good hygiene, and keeping an eye on our symptoms. We're keeping an eye on new variants as well, particularly the UK B.1.1.1.7 variant, which is extremely contagious and may cause more serious illness in seniors and persons who are immunocompromised. Since the last week of December 2020, the Bay County Health Department has provided over 10,000 vaccines in Bay County. This week, the Health Department will provide over 2,000 doses of vaccine through our clinics at the Bay County Community Center and Delta College. These will be primarily first doses at the Community Center and second doses at Delta College. We also have new pharmacies such as Rite Aid and Myers that are receiving vaccine supplied directly from federal sources. And we expect that the state of Michigan will make good on their promise to increase supply chains in the coming week to local health departments so we can dramatically increase the distribution of vaccine to Bay County residents. The UK variant, or the B.1.1.1.7 variant, has now been reported in over a dozen counties here in Michigan. This variant will become the predominant strain in Michigan in the coming weeks. And as we noted earlier, the strain is highly contagious and may cause more serious illness in immunocompromised persons. We need to continue to do the basics to stop the spread of this virus: wearing a face mask around others, staying 6 feet apart and distancing from others, washing our hands often, ventilating indoor spaces. Finally, if you are having symptoms that are associated with COVID-19, please isolate and distance yourselves from others and seek testing as soon as possible. About 10 days ago, we made some significant improvements to the registration and scheduling process. We still reach out with phone calls and emails to register individuals and schedule appointments. With these changes, it is very important that you monitor your phone and email accounts, especially with these appointments looming. Very often, when trying to schedule these appointments, our staff run into situations where individuals are not answering their phone calls or returning emails. It's a very time-intensive process, and subsequently we have difficulty scheduling these appointments. So please, keep a close eye on your phone and your email, especially in these coming weeks as we begin to expand appointments. With the expansion of the vaccine to other providers, you may find yourself in the opportunity to obtain the vaccine before an appointment is scheduled with the Bay County Health Department. If you have the opportunity to obtain a vaccine from another provider in the community, you may call and leave a message at our COVID-19 hotline at 989-308-1828, or send an email to bchd@baycounty.net with the words "cancel my appointment" or "registration" on the subject line. In the body of the email, please include your name, your date of birth, and your phone number so we can cross-reference your registration and update our database. It's generally safe to take Tylenol, acetaminophen, or Advil, ibuprofen, after you receive the vaccine. Some people will have discomfort and others will have minor symptoms that mimic COVID-19. It's generally safe if you take small amounts of these medications. You don't want to take excessive amounts of these medications, however. One of the reasons is that you want to have your body have that natural response and build up your immunity. But taking excessive amounts can be toxic as well. So contact your provider or contact your local physician and determine with him what is the safe amount. But generally, a dose or two of Tylenol or Advil is going to be okay. That's it for this week. As the situation changes often, keep an eye on the website and the county YouTube channel. Stay safe and stay healthy.